Just want to briefly introduce our two expert panelists, Dr. Chari Cohen, who's president of the Hepatitis B Foundation, where she conducts research and implements programs to reduce health disparities and improve health outcomes associated with Hep B, hepatitis delta, and liver cancer. She's also co-chair of the Hep B United Coalition and co-founder and chair of the Hep B United Philadelphia and the Coalition Against Hepatitis for People of African Origin, just to name a few. She's involved everywhere.
Thank you so much, Lindsay. This has been incredible for me. I've been furiously jotting notes. I just want to thank our excellent presenters. You've really been able to highlight the importance and the effectiveness of community-led and community-engaged research and programming. It is incredible to see the outcomes that you can have when you leverage and you highlight and you harness the strength and the power of local communities. And I also want to thank our presenters for pointing out the challenges. You know, it's incredible to see what you're able to do with such little resources and to understand what some of the challenges are that we still face in the future. I want to just spend a few minutes talking about how we can build more national-based strategies to help support the work in local communities that you've heard today. And I can use Hep B United as an example because it's kind of what I know. So Hep B United was created in 2011, and it was created as a way to bring people together, people around the country who were kind of working in silos to address hepatitis B related health disparities. What would happen if we brought those folks together and we helped to build their capacity, conduct technical assistance and training, share resources with each other, create mentorship and partnership? What happens if you support that work locally on the ground and really leverage and strengthen the power of the local community? So we built Hep B United in 2011. We had 12 people when we started. We now have over 45 coalition-based partners in 42 cities, 28 states across the US. It's almost quadrupled, I think, in membership since 2011. And it was created specifically to address hepatitis B related health disparities facing Asian Americans, Native Hawaiians, and Pacific Islanders. It has since expanded to include members of the African diaspora communities in the US, as well as people who use drugs. And it is supported in large part by a cooperative agreement from CDC. So I wanted to just highlight some of the things that we've learned, that we've also heard today from our presenters. The strength here and how we can support local community organizations. Well, the strength here is, number one, building multi-sectoral programs. And you heard that today. Being able to bring together different partners, so community-based organizations, local coalitions, academic institutions, health systems, federal partners, people, strong leaders and strong communities. That really helps to break down the silos. It allows for sharing across and between sectors, which we found to be very, very impactful at the national level with Hep B United. Also, I think the second key here is elevating the expertise of local communities with an emphasis on learning and sharing best practices, asking what local communities need. What are the challenges your communities face? What are the best ways that you know that you can make change in your local community? With regards to Hep B programming, for us, it was, how can we help you to get people vaccinated, to get people screened, and to get people into care and address some of the discrimination and stigma? So asking what people need, elevating the expertise of local communities, and then building a multi-platform strategy for building capacity that helps meet the specific needs of each community and also helps bring people together. So things like peer partnerships and peer mentorships programs, things like learning collaboratives where you can have people from different partners come together who might normally not work together, but can share and learn from each other. Next slide, please. And so this slide just shows a little bit about what can happen. So what can happen when we support and build capacity among local communities, even with a small amount of investment? And you can see how impactful this has been. One of the unanticipated benefits of building Hep B United is that we were able to create a national voice where we didn't have one before. We now have a national unified voice that can help prioritize hepatitis B at a national level and elevate local community voices to the national forefront. That's been really important for us. But if you look at the programming, look at the outcomes of local community partners around the country, they're reaching over 25,000 high-risk people a year. More importantly, for sustainability, they're testing and disseminating innovative strategies to reach communities all around the US and then sharing that with each other. So you can see just how strong and impactful supporting local communities can be. And I just want to point out here that while we focus on hepatitis B and C today, and of course liver cancer that's associated with it, supporting communities like this, building capacity in communities is both sustainable and transferable. It doesn't have to stay with hepatitis B. For example, when we were thinking about building a national tuberculosis coalition, we used Hep United as a template for the creation and the design of TEA. So obviously long-term investment in communities is beneficial not only for individual diseases, but for communities as well. And with that, I'm happy to hand it over to Adrian. Thank you.